Record numbers of patients are facing huge waits of more than 8 or 12 hours in Scotland's A&E departments. Experts have blamed cuts in hospital beds and a collapse in GP and social care services in the community for the crisis, as the latest weekly figures revealed that 1,022 patients spent more than 12 hours in emergency departments in December 2019, compared to 148 in December 2018 and just 45 in December 2015. Camley's cartoon, A&E waits. The increases far outstrip the rise in A&E attendance, which has climbed by 14% from just over 94,000 in December 2015 to just under 107,500 last month. It comes as the A&E statistics for November also reveal that only 85.5% of patients were seen, treated and either admitted or discharged within the 4-hour target, well short of the Scottish Government's 95% benchmark. Dr. David Chung, Vice President of Royal College of Emergency Medicine, RCEM, Scotland said a lack of available hospital beds meant more patients requiring admission were stuck longer in A&E. He said, "We are now witnessing record levels of 8-hour and 12-hour waits in Scotland's emergency departments. Poor performance cannot be solely linked to increasing attendances. There's clearly an urgent need to build capacity in the system through restoring the number of staffed beds and building a primary and social care system that meets the demand of Scotland's growing and ageing society. Long waits mean patients on trolleys and care delivered on corridors. We must do better by our patients." In the past decade, the number of beds in NHS Scotland has been cut by nearly a fifth, from 25,751 to 20,791. Dr. Helene Irvin, a public health consultant who retired from NHS Greater Glasgow and Clyde last year, said she believes the reduction in beds in Scotland's largest health board has been too sharp during a period of growing demand. NHS GGC has reduced its bed numbers by 19.5%, to 5,613 last year, but around 20% of its hospital admissions are patients referred for specialist treatment or procedures from other health boards such as Forth Valley, Highland and Dumfries and Galloway. "You have to bear that in mind when you're calculating your bed requirements," said Dr. Irvin. "I think they probably don't have enough beds now based on how much work they're doing. You have all these elderly people from GGC, then you have all these extra people coming in from other health boards." Compliance with the 4-hour A&E target was consistently below 79% for NHS GGC throughout December. For Scotland as a whole, 3,405 patients spent more than 8 hours in A&E in December 2019, compared to an average of 1,300 in the previous 4 Decembers, from 2015 to 2018. The picture was even starker in relation to the numbers waiting more than 12 hours, which were 1,022 last month compared to an average of 4 more on this story. Visit the news article link.